Fall prevention and outcomes in the elderly population. Presented by Jonna Bass, RN, Pamela Maravich, RN, Susan Hoover, RN, Nursing 321, University of North Carolina, Wilmington, April the 24th, 2016. So, what is a fall? The National Database for Nursing Quality Indicators defined falls as an unplanned descent to the floor with or without an injury to the patient. Callis 2015. How can we, as healthcare providers, prevent falls? Each year, millions of people 65 and older are treated in emergency rooms due to falls. Out of those injuries, 95% are hip fractures. About half of all falls occur in the elderly home. Over 700,000 patients are hospitalized because of injuries associated with falls, costing about $35,000 hospital dollars per fall. Falls are the most common cause of traumatic brain injury in the older population. How to predict and then prevent falls is the challenge. Safety in all environments is the priority for all elderly persons, but particularly those who are at risk for falls. Evidence shows that the most commonly used tools to predict and prevent falls are lacking, and that there must be evidence-based results to predict and prevent falls. Fall prevention is the key to prevent falls, and the intent of any fall prevention program should be to prevent a person from becoming a faller. According to Callis 2015, presently the fall risk assessment tools are lacking and leave off many risk factors that have been known to cause falls. The ones used in this study were the Morse, Hendricks 2, and the St. Thomas fall risk tools. Fall risk assessment tools have been in question for many years. It may seem attractive and an easy fit for a hospital or assisted living facility to use these tools. However, there are serious issues involved in their use, as they can give hospital staff a false sense of reassurance. It has been shown that numerical falls prediction tools do not work well, and falls prevention requires a wide range of interventions. One research study has shown that literature-based and data-driven approaches are better at estimating fall risk than commonly used fall risk models, as they include more variables in their studies. The number and type of variables for someone living in the home changes from person to person, and therefore can change the risk factors for falling. These variables are important for prevention outcomes to use when predicting falls in community-based elderly persons. In an Australian study, they used a fall risk assessment tool, FRAT, that showed when a resident was deemed a high risk by the FRAT, there was no information regarding when, where, or why the person is at risk to help improve prevention. Some FRATs can identify individual risk factors that, if addressed on an individual basis, was felt to reduce a person's risk of falling. However, it was shown specific environmental or situational knowledge is needed to prevent a fall. Therefore, this study believes that workers in assisted living facilities need to gain knowledge to enable them to connect risk factors with preventive actions to effectively participate in fall prevention. Causes of falls in hospitals and assisted living facilities and communities are serious. We need to be aware of what causes the falls for the elderly. Prevention is the key for the elderly at high risk for falls in all areas. Hospitals, assisted living facilities, and communities must be prepared to educate the family, the elderly, and the staff, which is most important. The Joint Commission and the CDC, Center for Disease Control, have become active in the fall prevention assessment tools. This group also has designed a fall prevention tool. The Joint Commission has developed the TST, which is a targeted solution tool to prevent inpatient falls. The Preventing Falls TST is an online resource that provides a step-by-step process to assist hospitals in measuring fall and fall with injury rates, identifying and measuring barriers to fall prevention, and implementing the center's proven solutions for falls prevention that are customized to address specific barriers. This tool also guides the user in the process of measuring the current state, determining root causes, selecting targeted solutions, and control of process after implementation. The CDC has developed the STEADY initiative. STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. The CDC believes that falls are not an inevitable part of aging. There are specific things as their healthcare provider that can be done to reduce their chances of falling. STEADY's tools and educational material will help the healthcare system to identify patients who are at low, moderate, and high risk for falls, identify modifiable risk factors, and they offer effective interventions. The fall risk scoring tool that was developed by this group used 5 different models as a guide. We used the Fradup Morse Fall Scale, the Hendrick 2 Fall Risk Model, Johns Hopkins Fall Assessment Tool, and the Central Regional Hospital's Fall Assessment Risk Tool. Fall Risk Assessment Tool that the group developed consisted of risk factors, levels, assigned point value, and then, of course, the risk score. The risk factors that were used were mobility, recent falls, medication review, laboratory results, cognitive status and orientation, any equipment that the elderly uses, elimination of bowel and urine, urgency and frequency, their psychological status, vision, dizziness, or vertigo. There were different levels for the risk factors. Then they were assigned points according to the level. And then the final score guided the healthcare provider to the interventions. Positive outcomes from fall prevention is what drives the healthcare system. We want to help the elderly maintain their health, maintain and improve self-confidence, and we want them to remain injury-free. Strategies that can help reduce falls in the elderly is exercise. Exercise can be done sitting, standing, or lying down. Vitamin D supplements have been found to benefit muscle strength and balance. Medication review and management of sensory deficits. They should yearly get vision, hearing, and mobility checkups. And their homes should be inspected. Causes of falls plus fall risk tools equal plans for fall prevention. Fall screening and prevention goals are the healthcare's main focus. Fall risk tools are good indicators to assess what may cause a person to fall. They can be an excellent guide for nurses and families to use to create preventive measures and take actions in order to stop falls from occurring. A fall risk tool is not meant to be used as a stand-alone preventive measure for falls. Nursing outcomes must always be based on assessment. As in the risk tool used, diagnosis and planning interventions followed up with evaluations to be successful. And keep the elderly injury-free by preventing falls. Thank you.